This webinar will discuss urinary problems that can be associated with prostate cancer. Many people can suffer with urinary symptoms without having a cancer diagnosis. Not everyone who has a prostate cancer will have urinary problems or concerns. However, it is not uncommon to experience difficulties during treatment or post-treatments. Urinary difficulties can be associated with not drinking enough fluids. Most people should be drinking between 1.5 litres to 2 litres of fluid throughout the day. If you don't drink enough fluid, your bladder capacity will shrink and it will become more sensitive. And if your urine is more concentrated, this will make your symptoms worse. The type of fluid you drink also may make your symptoms worse. The drinks with the green tick will not irritate your bladder, like water, decaffeinated tea and coffee, diluted fruit juices, herbal teas, and red bush tea. Drinks with the red cross will irritate your bladder, so these are best avoided or drunk in moderation. These include caffeinated tea, coffee and hot chocolate, green tea, alcohol, fizzy drinks with sweeteners and fruit juices that are acidic. These are the common urinary difficulties people can experience. Not emptying your bladder properly, frequency, where you need to go more often than every 2 hours, urgency, needing to go to the toilet straight away and unable to hold your urine, hesitancy, where you stop and start while you're passing urine, weak stream, where it is not a good flow and dribbles out, pushing or straining, where you have to push and have to think about passing urine, and Northampton, getting up overnight to pass urine. These symptoms are measured using the International Prostate Symptom Score questionnaire, and this will enable the healthcare professional to get a clear picture of your symptoms. So you may be asked to do this when you see one of the clinical nurse specialists. Other urinary problems may include burning, where it hurts when you pass urine, Hematuria, that's blood in the urine. This can be rosé in colour or bright red or a dark red colour. Cloudy, offensive urine. When you pass urine, it smells. Dysuria, where it's painful or difficult to pass urine. The kidneys are constantly producing urine throughout the day and night as they are filtering the blood for waste products. The normal amount of urine you should expect to pass is between 800 and 2 litres per day, depending on your fluid intake. If you only drink a small amount, you'll only pass a small amount. This is a colour chart explaining what colour your urine should be. Everyone's urine should be pale yellow colour, colours 1 or 2. If it is a dark yellow, 4 and 5, then you need to drink more fluids. And if your urine is dark brownish colour, 7 and 8 colour, you are dehydrated and you will need to drink plenty of fluids. If your urine is pinkish rosé colour or bright red, dark red, this may mean that you have blood in your urine and you should seek medical advice. However, some foods may colour your urine. For example, if you eat lots of beetroot, your urine will be pinkish in colour. This section of the webinar will explain how to manage these urinary symptoms. Not emptying out your bladder completely, where you feel like you need to pass urine after half an hour of passing urine. We can help with this by doing some basic bladder training, where you go to the toilet every 2 to 3 hours and change your position which you pass urine. Sometimes when you sit down, it's easier for you to pass urine, and vice versa. If you usually sit to pass urine, sometimes standing may help. You may need to perform intermittent self-catheterisation. This may be because you have a narrowing in your urethra, the water pipe, as a result of either surgery, radiotherapy or trauma. You will be taught by a specialist nurse how to pass a catheter, a small tube, up through the penis, up into the bladder to empty out your bladder. This may be something you need to do every day, weekly, or more frequently, depending on your individual needs. Other urinary symptoms, including burning, blood in the urine, cloudy offensive urine, or pain when passing urine, can be associated with a urinary tract infection. But this may also be because you are not drinking enough. So drink 1 pint of water to see if these symptoms resolve. If these symptoms do not improve by drinking more fluids, you will need to seek medical advice because you may need to have some antibiotics to help alleviate these symptoms. Urinary frequency can be caused by drinking too much or too little, so think about how much you are drinking and either decrease or increase your fluid intake. You should remember you should be drinking 1.5 to 2 litres per day. It may also be due to the type of drink you are having. For example, caffeine, alcohol and some fruit juices can irritate your bladder and make you want to pass urine more frequently. If you haven't tried improving your drinking habits and urinary frequency continues, you may need to seek medical advice as it may be a sign of infection. Urgency. This is where you need to pass urine, going to the toilet less than every 1 or 2 hours. This may be because it's a habit of yours that you either go every advent break or before you do an activity like going out for the day or when you pass in a toilet. Try to avoid doing this by only going when you need to pass urine. You can also practice pelvic floor exercises, which I will explain during the next slide. And you may need to have some medications which can help relax your bladder muscles and increase your bladder capacity. You will need to speak to a medical professional to help advise this. The pelvic floor muscle sits from the pubic bone to the tailbone and with the prostate and the bladder above it. As people get older or after prostate cancer treatment, this muscle can weaken, particularly after surgery. You may be taught how to do pelvic floor exercises. This can also help with incontinence of urine as well. We can provide further information on how to perform pelvic floor exercises via a leaflet and talking you through how to do these. However, if you squeeze the muscle when you're passing urine and you can stop passing your urine but still be able to breathe, this is a good indication this is your pelvic floor muscle that's helping you to do this. Luxuria, where you get out of bed overnight. Consider what time you last have your drink in the evening. If you drink after 6 p.m, you are likely to need to go to the toilet overnight. So just drink a small amount of fluids after 6 p.m. Also consider what drinks you are drinking late at night. Caffeine and alcohol will make you want to pass urine, and this can be particular overnight as it irritates your bladder. If you are taking some medications like tamsulosin, it may be worth taking this in the evening to help alleviate these problems. Also consider if there's anything else that's waking you up during the night. Are you getting hot flushes? Is the dog waking you up? Is it just because of habit that you usually get up at 3 o'clock in the morning? And is it somebody waking you up like the milkman? And try and resolve these concerns and break the habit of getting up in the night when you are disturbed by these things. Incontinence, this is where you're leaking urine. It can be just a dribble when you cough and sneeze, or jumping up and down, or from sitting to standing. Or this can be a continuous dribble where you have no control at all on passing urine. You need to practice some pelvic floor exercises by squeezing that pelvic floor muscle to help alleviate that. And if you know that it's when you start to cough or sneeze, or if from sitting to standing, then try and squeeze that muscle before you do that activity to help with the continence. You can also have continence pads. Continence Advisory Service can offer further advice for this on this telephone number, or you can buy various continence pads in any good supermarket or pharmacy, and the pharmacist should be able to help you with the choice, as there is a wide range of pads available, including very small ones for just the occasionally to heavy, thicker pads for continuous dribble. It may be worth considering if you're continually dribbling to have a urethral sheath. This is like a condom that fits to the end of your penis, and the leg bag is connected to the combi where the urine is collected, and you can empty it at your own convenience. You will need to be assessed and taught how to put one on by a specialist nurse. And if you need further advice on this, please get in contact with us. Penile clamps can also be used. Again, this will need to be taught. You will need to be taught how to use this by a specialist nurse. There is also a device called Aphex, where this is where you have a pants with a collecting device attached to the bag, and this can help. So it's very similar to the urethral sheath, where it collects urine and you can empty it at your own convenience. If you need any advice on any of these products, you will need to get in contact with us. Sometimes after surgery, you may have a continuous leak, which may need a referral to a specialist for either Botox, which is where Botox is injected into your bladder to help incontinence. You may need to be assessed for an artificial sphincter to help with this, and you may need a urethral sling. For further advice or any other information or leaflets, you can contact us on these numbers. And also Prostate Cancer UK are a good resource for further advice, and the Bladder and Bowel UK. Thank you very much for watching.